Right, sorry about that, a little technical glitch. If we can have bags of hush, would be much appreciated. Thank you, Mike. Rightio. Welcome back to stage 2 of the Social Sustainability Subcommittee. We're going to do a slight change, and apologies to Morag again. Should have just done you first, Morag. Sorry about that. We're going to jump to the updates while we have CAG in the room. The 8.1, which is a health strategy planning update. And I'll pass over to Chris and Gina.
Thank you. Just as an opening, we're very pleased to be able to start a conversation with you around the health strategy. As we mentioned in the earlier report, we are working with CAG and others to inform the development of this. And I guess I just wanted to impress upon you the fact this is an opening discussion today. So we are looking to just step through some of our sort of our approach and our framing for the health strategy to get some input from you, and then we'll continue to undertake work. So Gina is going to step us through that. So I'll hand over now. Thanks, Gina.
Thank you. So I'll just kick into it. You're obviously all aware of the health strategy that we're working on, and we're really mindful that there's been quite a lot of background work done by groups like our Kāpiti Health Advisory Group and others actually, the Kāpiti Health and Wellbeing Advisory Group as well, on the needs for our community. So this kind of reflects some of that background work that already exists. Why we're doing this work, the context that we have is that there's significant health system change and activity happening at the moment, and we have the opportunity to influence, advocate and act across all of that existing work and to continue our role looking at the availability, accessibility and affordability of services for people in our community. In the background, we are working on a donut economic model, which really highlights the interconnections between different needs that people have. So we want to take a bit of a systems approach to looking at influencing factors, health determinants, things like housing, food, socioeconomic factors, social support, business environments, some of which we have a stronger acting role in. So things like we do provide housing, and some of which we are in a more influencing environment for. And obviously the mandate, we have health being a council priority and specifically the development of a health strategy, which is also mentioned in the annual plan. How we do it, this slide's a bit busy, apologies, but we've outlined some of the timeframes that we've got in here. We want to have a high-level narrative outlining some of the high-level information about what we're intending to do through the health strategy in that LTP, so we will include that. So this is the LTP for 2024, and we're going to incorporate some of the feedback that we've had through the vision work and produce a bit of an outline of focus areas. So we really want to hear the voice of the community in what we're trying to do. And we do want to take a bit of a targeted approach with some of the key stakeholders, and as well through that Vision Kāpiti work. We're really mindful that there's been a lot of background work and engagement with the community and other stakeholders on this, and there's a desire to move to action sooner rather than later. So we don't want to overdo the engagement and have people suffer from engagement fatigue, but we also want to make sure that we're getting the right voices involved. We've got some notes there on other when we'll be bringing more information back to this subcommittee, to council, and to whakamenenga or Kāpiti, and so that's between now and February next year, and we will start drafting the strategy late this year to have something ready for engagement through the engagement hub early next year, with the aim to have a strategy in place by mid next year. What will it look like? So we have the aspiration. So what is it that we want to achieve for our community? And we want that to reflect the voices of our community as well. Iwi community and other stakeholders. We have some existing data and information that we want to use for a needs assessment, and a bit of information on some of the social determinants of health needs as well. And then we'll do an outline of current state, a little bit on kind of the ecosystem that already exists, what are existing services, known challenges, other work underway, and do a bit of a gap analysis of what's missing. And then we'll get into the activity. So what is council's role in this space? Where do we fit in that ecosystem? And where might we have an advocacy role? Where might we be an enabling force? So in particular, how do we make an environment that health-related businesses can come to Kāpiti and set up? And where we might take specific action. And some of that might be in some of the social determinants of health space where we have a stronger role, as I've mentioned. And then we want to make sure that we're measuring what we're doing. So what's going to change over time, and how do we know that what we're doing is making a difference? This is a little bit of a slide about who we want to talk to. It's not exhaustive, and there's a stakeholder list later, which we're very happy to hear feedback on whether we've got the right people involved. But we have some indication there about the different groups we want to involve and some of the specific things that we think that they will be interested in or have really good things to contribute in. So we're obviously working closely with the Kāpiti Health Advisory Group. We'll work with iwi mana whenua Māori, and then our service providers and NGOs, other community and advisory groups, and I'd like to highlight particularly we have a Otaki Health and Wellbeing Advisory Group as well, so just want to acknowledge that we know the importance of our different communities and the different stakeholders that we have in those communities and the different challenges and positions of the different communities we have, and obviously engaging directly with people in the community as well. So what do we expect to see? As I said, there's been a lot of background work that's happened already. So we already know that we have a higher than average age profile, and working in with that, a higher than average rate of disability. And we have some pockets of disadvantage, or I might describe that as specific challenges for different areas of our community, or Taki being an example of that. And we have a need for service provision to keep pace with the growth in our district across the whole of the life course, including for youth. And we have some known challenges, and I will say that some of the feedback that we've already had through our Vision Kāpiti Hub has really been in line with these known challenges that we already know about. So access to primary care, and a lot of that is about having GP services available locally. Access to hospital and specialist services, some of that's about transport and some of that's about the location of more specialist related care locally. Access to urgent or emergency care in 24 hours, and access to mental health care, including for youth. We also have some limited care for people with disabilities and limited local care for older people. And then in the priorities that we might see in the health strategy, we might want to build more of an understanding. So we might want to gain more in-depth data on our community needs. We might have a role to play in gathering some of that. We might want to get involved with our community, perhaps run a survey in that space. There is existing data. There are lots of agencies that collect data, but that doesn't necessarily cover the whole span of things that we might want to know about. Lots of it is service related, for example, as opposed to related to the actual health conditions and status of our people. And prevention, we want to act on those social determinants of health. The example of education that was talked about earlier in this committee meeting would kind of fit in that space, prevention and promotion. And some local and integrated services making sure that we've got those available here, and again, urgent care. And a bit of a forward focus. We have a good population and location to enable some smart technology-based solutions to access to care. And as I mentioned, this is our stakeholder list at the moment. It's not exhaustive. It's never going to be fully exhaustive, but we want to work with as many people as possible. So we're really happy to hear feedback on groups that we might have missed from this list, or any feedback on other people that we think we need to engage with. And I think that's the end.
I just might add a note to say, when we look at that list, I think perhaps pleasing for Kāpiti, but also I think part of the challenge in the health space is there are a lot of people working in our health ecosystem. And one of the things that we're really focused on is making sure that we are able to, as a local council in that space, think about how we are facilitating and convening and working with that wider ecosystem with CAG, so that we're thinking about how we bring, that one voice to the table, which gives us a more powerful position when we're talking to other stakeholders like central government, or actually other communities as well. So also just wanted to note that one of the things that CAG talked to you about earlier around the idea of what can we do in this district, part of that is thinking about how we're working with our business community as well. And there is an intention now that we've landed the terms of reference that the chair of the EDKB will be coming to, we'll be arranging him to come and meet with CAG so that we can further that discussion. So I just didn't want to lose sight of that either.
The end. Any questions, anyone?
Yep.
Kathy?
Thank you. Great presentation. Thank you. But to me, employment is also a determinant of health. So just wondering on there, should we be talking to the local work and income or MSD just to get a handle on the unemployment?
That's
Right,
a fantastic idea. I think one of the reflections that we had, and I do keep talking about this, and with community board member Jackie Elliott here, I'm sure she will say yes and have more ideas about this, but we had the Ōtaki Safety Symposium this week on Monday, and it was, from my perspective, amazing to see a wide range of central government coming together and looking at the interactions and them thinking about how what they do is actually having a positive or negative impact on some of the outcomes in the community. So there may be a wider group of stakeholders in that central government space that we say, actually, we do need to bring them in here. So one I might add onto the table, which I was speaking to you about earlier, was Kainga Ora and the Ministry for Housing and Urban Development, and some of the work they're doing, and also the contracts that they're funding to make sure that they're focused on not only housing, but health outcomes and safety outcomes and other things. So I think there's a genuine opportunity for us in that space to think a bit more broadly. So that will be part of the ongoing work I think comes through.
Okay. Kathy, I've just noted a gold star for you up on the chart out back as well. Excellent question. Do I have anyone else that has any other questions in regards to the update? Oh, fabulous. Okay. Well, look, from my end, thank you very much. This is, again, this is all part of it. I guess the only thing I really wanted to note, two things, is we've still got this boundary issue. You know, that's a big elephant in this room with regards to services, pointing, Ōtaki pointing north rather than south. So that's an issue that I think needs to be, we need to get addressed as such. And that's an ongoing scenario, but I think we're getting closer and closer to really sort of taking that one on board. And I just do note that we do have the health group up in Ōtaki as well, and this is not an exclusive but an inclusive situation, and the doors are always open for them to be involved in the processes that we're doing as well. So other than that, thank you very much to council officers, and we will move on, and thank you very much for you guys being here. You're more than welcome to stick around if you like, but we have the becoming a living wage employer next, which not really a health thing, but hey, look, it's all about everyone's well-being, I guess. But thank you very much for taking the time out of your day to be here today. Much appreciated.
Okay.
All good?
Yep.
Okay. Moving on to 7.1. Morag, come on down. Come on down. Yeah.
Where's that from? It's in the bag, or
Hmm?
is that from which TV show was
Come on
from?
down.
It's in the bag,
Yeah.
or
It might have been.
I don't
It
know.
might have been.
Oh, that's okay.
I didn't
Yeah.
think you were that old.
I'm not.
Oh, because I remember it.
Vague reference.
Sorry. Come back to on hand. Thank you, Morag. You're presenting the paper to us. I'll leave it to you.
Kia ora koutou, ko Morag Taumalia Tāne, taku ingoa. You've probably heard my name a lot already today, so thanks for having me. So yes, I'm here to present the paper on becoming a living wage employer. I gave a briefing to Council on this last week, and I'll just quickly run through what I covered in that briefing. In terms of the journey so far, councils in the Wellington region have been shifting to living wage accreditation since 2018, when Wellington City started, and then the Hutt City and Porirua City. And on the 25th of August last year, the council agreed to support the principle of KCDC becoming a living wage employer and asked for more information, and we went back on the 8th of December, where the council agreed to progress with investigating us becoming an accredited living wage employer in accordance with option A, which was review all the contracts through a staged approach. So in terms of the living wage criteria, there's 4 different parts. One's about all council directly employed staff being paid the living wage. That's criteria A. Criteria B is the indirectly paid workers. So that's where we have contracts on a regular and ongoing basis, and ensuring that those people that are providers are paying their staff the living wage. Then it's about employers having provided workers with access to a union, and that employers' terms and conditions aren't reduced when an employer is trying to move to the living wage. So we meet criteria C and D, and at the time we spoke with council, we met criteria A, which was all council employed staff were paid the living wage. But on the 1st of April this year, the living wage announced their annual increase, and it was after a 5-year review, and so it was a bit more of a significant increase than had been expected. So it was a 9.9% increase and took the living wage up to $26 an hour. So that came into effect actually on the 1st of September this year, and so that meant that council needed to increase remuneration for a number of roles to continue to meet criteria A. So that meant that council officers expanded our scope for what council had asked us to do back in December, and looked at the implications of meeting criteria A as well for directly employed staff. So as part of the 2023 remuneration review, I can confirm that all directly employed council workers are paid no less than the $26 an hour, which is the living wage. So we do continue to meet criteria A. Costs to meet that increase was considered minor in the context of the overall personnel budget, and as an organisation, the council has confirmed they're going to continue to pay the living wage to staff. So that was an organisational decision, and so there'll be an annual living wage remuneration adjustment going forward. Which leaves us with criteria B. So in terms of what's in the paper, it provides a bit of background in terms of how we've worked through that to identify what contracts were in scope. So we've worked with, chatting with other councils, Dunedin City Council, we've worked with Living Wage, the advisory board, to get feedback as well in terms of our scope around that, because regular and ongoing can have quite a broad scope, but we narrowed it down to focus on identifying contracts where service provision in industry, which traditionally included low wage positions. So we looked at about 57 of our contracts that were within that scope, and of that confirmed basically that there were only 5 contracts that were actually within scope and were not paying the living wage currently. And so one of those organisations was looking to move all of their staff to the living wage in the recent remuneration round. They haven't quite made it, but are not far off, and we're just waiting for a bit more information back from them. And then another 3 would need to be supported to shift to the living wage. And that would come at a total cost of $60,000 for those 3 contracts. In terms of moving to accreditation, you'll see within the report that staff have recommended immediate accreditation. This supports the work that's been done to date. The fact that we have a really clear understanding at this point in time in terms of what the implications would be for us to receive accreditation for Criteria B around the contracts. There will be a new living wage announced on the 1st of April, so it will begin again. But taking the step now to go for accreditation would mean that we're in a really good position when that happens to continue those conversations with organisations as we work through whatever the new living wage would be from the 1st of April. We'd also be putting in place certain assumptions, budget assumptions going forwards in terms of what that living wage increase may be, so that that's actually planned for future years. And that would be from obviously the organisational perspective for directly paying staff, but also for Criteria B. So looking at those contracts that were in scope and working out what the implications may be going forward, but also ensuring that when we contract new regular and ongoing services, that the living wage requirement would be built into those contracts at the beginning. So that would just be for regular and ongoing contracts at this stage, which is a very small number of contracts that we would hold, and is usually around things like security, cleaning, road maintenance, things like that. So, are there any questions? Oh, I could actually, if you don't mind, I'll just quickly cover off the answers to a few questions that have come up previously from elected members. One was about apprentices. They aren't covered by the accreditation policy because their pay rates are regulated by law. So that would be for most, in terms of our contracted services. There were some questions around that. Vehicle provision and phone provision as part of a contract doesn't count towards a wage in terms of the living wage. So it is actually the $26 an hour. And there was a question at the recent briefing around the minimum wage exemption for people working with a disability. So from a council perspective, we would be required we would not be able to use that as an exemption for staff that we employ directly, but that can't be put onto people that contract for us, so they would be able to apply if they so wished.
Thank you for that, Morag. Much appreciated. Are there any questions at all? Got Nigel first, and I'll see you there, go.
Oh, I just wanted to move the recommendations, so...
I might have to go through the questions first, if you don't mind, Nigel.
Just
Hey, Guy.
a quick one. When you say contracts, can you explain that further? Because you've got contracts, you like security staff, but also you've got contractors doing the drainage out there. So can you just clarify that, please?
Yeah, so we've worked really hard to make sure that we're quite clear on what the difference is. So in terms of people doing the drain laying out there, that's a project. So it's not a regular and ongoing service that's provided to council. So when the living wage is looking at this, they're looking at it from a perspective of somebody that we are paying on a regular basis or contracting to do a service on a really regular basis. So, for example, cleaners coming in twice a day, security guards, as we're talking about. So it really is that maintenance side of it where it becomes that rather than that project scope.
Have you got a ballpark figure on the number of people?
That will be impacted?
Doing the contracts on that service level, roughly?
I wouldn't have a ballpark figure, but I think the $60,000 in total that we think it'll cost with a $20,000 contingency, which you'll see is mentioned in the recommendations as well, would give it the indication that that's an annual figure. So it would give the indication that it's not a significant amount. And actually, I was really heartened as I went through this process to note that all the organisations, or the majority of them that were contacted, were already paying their staff the living wage or above. Yeah.
That's great to know. Johnny?
Yeah, look, I mean, I think it's really great that the council is paying its staff at least the living wage, but I just can't understand why we're sort of forcing other businesses that contract to us. I mean, there's been a lot of overreach over the last few years, and I just sort of think this might be a little bit of overreach impacting on other people's businesses. So where did that come from?
So this was a notice of motion that came up from elected members. So council officers have been working to respond to that and to understand what the implications would be going forward.
I hear what you're saying, Johnny. I dare say that's what this contingency is for, so that there is an increase by... this policy is not meant to disadvantage people. And the contingency is there if we have to increase the contract allowance, and I stand to be corrected, in regards to any of those things, so those employees are getting that amount, so that, if you like, a provider is not put under a stressed situation as such. Potentially you'd love to see them up to that. I appreciate being from a small business perspective, that could be challenging as such, so the contingencies there are to top up, if you like, if that's required as such, rather than, should we say, a contractor losing a contract because of not being able to do that. Would that be a fair comment?
I'd just clarify that the $80,000, the $20,000 contingency is just if we were going through the accreditation process and as we're working with the advisory board, if they identified any other contracts that they thought were actually in scope that we hadn't already worked with them on. I have been working with them pretty closely, so I've been checking in on quite a lot of the stuff as we work through. But also the $80,000 is in the total context of about an $80 million space there. So it's in terms of the contracts that the council holds that sit within the scope of the accreditation, which is the criteria is defined by living wage itself. This isn't criteria that council comes up with, but it's a very minor amount in that larger context in terms of who's actually in scope.
Could I clarify, Johnny? You're referring to a business that might contract to council being at a disadvantage if they didn't pay the living wage?
I just guess that, for them to actually contract to council, then they must pay the minimum wage. But, I mean, it's sort of like if they want to contract to us, we're sort of telling them almost how to run their business and how to pay their staff, if you know what I mean.
Yeah, look, I would push back against that a little bit. What we've done is we've made a decision as a council that we want to lead by example with regards to the promotion of the living wage. We're providing resources if a small business is under stress to do that. But we're looking to create a more equitable wage, and we're leading. I think the aim is to lead by example as such.
Yeah, and I have no problem with that, and we're leading by example by paying our own staff the living wage.
Yeah, I appreciate that. Thanks, Johnny. Lawrence.
Can I just clarify your answer to the question around disabilities? So you made a comment in there that council was unable to apply for a reduced hourly rate for people with disabilities. Is that what I heard you saying?
Yeah, so there's an exemption, a minimum wage exemption that you can apply for in terms of employing people with disabilities. But if we became an accredited living wage employer, we would, you can apply to the advisory board for an exemption to that.
Okay.
But I think it's happened once. But the expectation would be in general that you pay the living wage as they are an employee.
Okay.
Yep.
Okay, so it's related, it's not a legal limitation that exists for council, but it's related to the accreditation.
Absolutely, to the
Okay, cool,
accreditation.
that's
Yep.
great, thank you.
Any other questions? Nigel.
Yeah, so I'll move it. Move the
Fantastic.
recommendations.
Um,
A to E.
Nigel, can I ask, would you be looking at taking the recommendations as a whole?
Yes.
Yep, that's A, B, C, D, and E. Can I have a seconder for that? Kathy, happy to second that. Nigel?
Yeah, I'll keep it. I've even got 14 pages this time. The reason for going immediate is actually not even immediate, really, because we've been discussing this for a long time. We're one of the few councils in our area now that isn't doing this, so there's nothing dramatic about it. The implications of not doing it are completely unacceptable, I think. It's called the living wage for a reason, and for a lot of people it's still actually not a living wage. It's getting somewhere near one, but it still doesn't cover the basis. It's a protection for the most vulnerable people. In terms of the impact it might have on contractors, I cry myself to sleep at night thinking about how those CEOs manage to live on $1,000 an hour. Some of them more than that, actually, $2,000 an hour. So it is incumbent, I think, on council to spread the fairness. So we decided to be a living wage council for moral reasons. You wouldn't do it for economic reasons because it costs you more money. So you do it for moral reasons. So if you do that and you think that's fair, it's unconscionable to then say a different form of morality should apply to the people who are actually doing the work on our behalf. So if we can have an influence in doing that, then so we should. As Morag's pointed out, and she wasn't making a political case, but just pointing out the numbers, the implications of this financially are minuscule compared to what you get. So that's all I have to say.
Thank you, Nigel. Jackie?
Thank you very much, Morag, and for your work on this. It's nice to see that it's an $80,000 question because some of us might remember well CE Pat Doherty sitting here and saying that we had just asked him a $1 million question when he worked out the actual new cost to the council of bringing living wage rates for all of the staff at that time. Yeah, it's quite interesting. We didn't quite believe him, but it is quite interesting that now it's an $80,000 question, so we must be getting closer to pay parity there, and yes, I'll be supporting this.
Councillor Hanford?
Yeah, I just want to also add thanks to the team, to Morag and also to Lindy McIntyre and the many relentless advocates in the living wage Aotearoa New Zealand movement, and also the fact that included in the recommendations, if we look to recommendation E, is that the subcommittee recommends to council that accreditation is sought immediately, and so that's really cool to see that reflected, because I think, yeah, we might as well not delay. As Councillor Wilson said, the kind of cost of inaction is far greater. It's the perpetuation of further inequity in our community, potentially, when we have the chance to kind of stand on a really strong moral imperative and do something about it. So great to see that we're, hopefully, if this gets to council and is all signed off, we'll seek immediate accreditation.
Guy?
Yeah, I think we should stick with the status quo. All the staff of council are getting the more than the minimum wage, so we're already meeting the criteria. I think we should leave other businesses, leave it up to them to decide what to do. It may limit our ability to get locally sourced people or contracts in the future and lead to further costs for council.
Thank you for that. Anyone else? I guess my bit to add to that is taking on board what both Guy and Johnny said around those. I can assure you it was heavily debated, those aspects of it, when we workshopped this. I'm not going to go into the bits and pieces of it, but it was talked through, and I dare say it could potentially be talked through again when this goes to the next step as well. As such, so that's definitely been noted. But we were given very clear assurances, and I remember at the time being quite satisfied with the answers with regards to ensuring that no one locally who has a business will be disadvantaged or put in a precarious position because of this policy. Would that be a fair call, Morag? Oh, no, actually, I'm not going to ask, no, that's not fair. My apologies, Morag. Yeah, just shuffle that one over. As such, so I'm comfortable in that space as we move forward through the decision-making process around this. Right of reply?
Yeah, I'm not sure. Yeah. That bit's been stricken from the record. So no, we're all good. It's it's long overdue. And welcome to the 21st century. Good stuff.
Lovely. Okay. With that in mind, we'll be moving the motion recommendations A through E. All those in favour? Aye. All those against? That's Johnny Best. Johnny, would you like a division at all? Okay. But it is noted. Thank you very much. Thank you very much, Morag, and thank you for your patience this afternoon. Hopefully you got a good cup of coffee out of it. Rightio. Moving on to now, I'm just going to note that we have got members' business. I missed that earlier, but I would like to do the confirmation of the minutes first, and then move to number 6, members' business at that point, if that's all right. So, in regards to item 9, 2964. Sorry, be with me for a second. Okay, 9.1, confirmation of minutes. I will take that as read. Do I have a mover? Or any questions? Happy to move. Okay, Lawrence, happy to move. Do I have a seconder? Nigel, any debate? No? Right to reply? Passed. Thank you very much. All those in favour? Aye. Aye. Fantastic. Thank you very much. That's passed. So we now come to members' business. So that's 6. Leave of absences. Anyone requesting a leave of absence at all? No? Fantastic. Matters of an urgent nature. Are we missing a point out of here?
No, we moved it to the end, but it's not on there. See, yeah, members' business.
Yep.
Shall I add it?
Yep, if you don't mind. Members' business, yeah. Okay.
Items, I think it's called.
Yep, that's cool. Sorry, my fault. So no matters of an urgent nature have been brought to my attention, so we'll move to members' items. I have 2 that I've indicated. First one was Nigel in regards to just some follow-up around the conversation you brought to the table a little while ago around the CAB and funding through the long-term plan, etc. Did you want to give a little update where you might have be with that, or as such?
Yes, of course. Planning for this for weeks. Right, the CAB. Just the ongoing conversation about how the CAB, I think their total costs are about $37,000 a year, and the value back to the community is about $370,000. They've got a whole bunch of people with enormous skills who charge nothing for their time. And we, as a community, are the beneficiaries of that. So the plan was to, back in the day, they used to be funded by council, or partially funded by council. The recommendation is that we put that back into the plan. That will, we had Hunter Donaldson come in from CAB and talk to us. The plan is to put that into the LTP. So I'm assuming that will come as a recommendation from this committee. Would that I'm not sure.
We can investigate that really for the next meeting if you like.
Can we? Yeah, just that would be.
I don't know if that's the appropriate pathway, but we'll get that clarified.
Yeah, that would just be my point is to be able to give the CAB clarification about what is the process from now, because I get asked that. So I've said to them, my spidey senses tell me that council is quite keen to support the work CAB do, and the overall cost isn't dramatic. So, but what's the process?
So could I potentially ask council officers if that's possible to follow up on that? Just with Nigel? Not immediately.
Yeah,
No,
no,
yeah.
well, yes, it is, because at an officer level, we're also in conversation with the CAB. So I'm happy to talk with the councillor offline about the fact that there are several options in terms of how that gets on the table through the LTP process.
Fantastic. Thank you very much. Thanks, Nigel. Thank you. With that, the other one was Mike. Mike, you brought up the issues around the bus route up to Horoway, which sort of led to a bit more of a further conversation around transport in general. But did you want to sort of update us in that space at all?
Sure, okay. Look, maybe a good way to kind of introduce this subject, because it's been around this table for the last few months, is starting from why I wanted to stand up and represent my community. And I know Councillor Wilson, who came along to the public meeting on this issue at Te Horo just a couple of weeks ago, where it's kind of come to a head where the community had just kind of got frustrated. And, you know, it's not a new subject for either the regional council or even this council, which really transport issues just fall through cracks because we don't really manage buses around here. But we should have an interest in how our communities are connected. And Te Horo is the kind of odd one out on the coast. In 35 kilometres of coastline, it's the most kind of disconnected, not only physically because it's rural, but no public transport goes near it. And there's quite a sizable population down there. And there's two issues which disconnect it, not only a public bus service, but a road which is really not resilient at all under weather conditions. And that's a separate subject to this, I know, but it is going to come up with a combined community meeting with regional council and some officers from council just next Wednesday night at Councillor Liz Coe's place. So the bus service has been a problem. In 8 years now, the community has not been served by the Metlink bus service 290, which goes between Waikanai and Otaki 16 times a day. And it's kind of got worse since the expressway opened up, because it doesn't even go on the old state highway. It now decides to use the highway, the new expressway, even though the regional council have made indications that they should start using that old highway again, which is where people, have access to it. So I don't know what this committee can do other than we're trying to advocate to the regional council and maybe go have a deputation down to the transport committee, which is chaired by Thomas Nash. But we've really kind of hit a bit of a brick wall almost on it, in that the current explanations from regional council are that they are waiting on revocation works. And I just want to add something on that because that's a big subject. The revocation works of the Mackay's to Peka have still not been completed since the beginning of 2017. So that's 6 years. And we haven't even scoped or designed or tendered the works for the revocation from Peka. In fact, it's at Makahuri, the old Marycrest, through to Otaki. So that's going to take at least 2 to 3 to 5 to 6 years. It's indeterminate. If there's another cyclone, something might distract from that project. But the works that are going to happen along that stretch of Old State Highway should not prohibit any bus service utilising it. So there's two issues here that I'd like the community to be looked at and serviced by a bus service. Not only that the bus, we can advocate as a council and our subcommittee and how we navigate that, but that it includes the community down at the beach where the predominant audience and community reside. You know, to drive to a bus.
So I'm gonna hop in there, Mike.
All right, thank you. Yeah.
Reason for that is you're actually talking to the converted. We're well aware of the problem and do appreciate that you've put your hand up to champion this, along with other people as well. I'm aware earlier emails that were circulated, some councillors put their hand up. We were talking about a transport committee, etc. Mayor Holborough, you're on the our representative on the regional transport committee. But I'm just wondering, is this transport issue, is this something that's falling through the cracks as such? I do appreciate in the last triennium we did have a portfolio in this space. As such, this is, I'm looking for some guidance from really on how we move forward on this. As such, are we looking at any thoughts? And I'm sort of addressing the mayor here.
So it's being progressed. This is the latest from Penny Gaylor, which was sent to other elected members as well, so they'll be aware of this. So yesterday I met with the group manager of Metlick and Thomas Nash to discuss how we can expedite getting the bus stop returned at Te Horo. They're working with Waka Kotahi to resolve as quickly as possible, and they'll provide more information shortly. Greater Wellington has asked Waka Kotahi to see how quickly they can complete their process so they can deliver the bus stop for the Te Horo community. In the meantime, the Metlink group manager is asking Userbus to revert the 290 service to run that route in anticipation of the bus stop being returned. Also attached the table of rating differential. So that's pointing out that part of the problem is that Te Horo is zoned as a rural area for public transport, and I think there are some other areas in the district that are zoned like that too. So it would be not a right as such, but an exception to do this, but they're working on it.
Chris, you wanted to comment on this?
I just wanted to add to that to let you know that we have sent 2 submissions through related. One was related to joining the dots, but related to public transport. So that has gone into a regional submission process. Just to note or reinforce the need in Otaki, Te Horo, and other parts of the community around public transport and the impact that it's having in terms of access to services. We've also submitted into a wider transport submission process looking at the engagement between regions and the need for stronger engagement. So happy to circulate that round to this forum, but just to note, it was in our usual policy submissions that we send around to everybody. They were 2 items in there. Some of you had already fed into that, but I thought it was worthwhile to note that and they were really good submissions, and I think an important step for us to have taken.
Lovely. Thank you for that, Chris. I guess part of the issue is where the follow-up potentially sits for this. Is it this committee? I'm not sure, and it's just, just getting some clarity around that so that we can just keep, at what point do we, not at what point, are we keeping pushing this moving through? Is it something strategy and ops, or strategy and finance or something along that sort of line, which I think is just will be part of the fallout of that. Did you want to comment on that, Michal Burrow?
Well, usually when things go to strategy, operations and finance, they would have paper attached to them. It seems like this is a more friendly forum for general updates on things. With transport in general, it's already been discussed that there are some elements of transport that are relevant to the Environment and Climate Subcommittee as well. But I will notice that we've finally got some progress now that we've got through the first stage of the speed management plan, in terms of resetting up the Road Safety Advisory Group.
Right.
So the terms of reference for that could be broadened to be general advocacy for transport issues as well.
That'll be fantastic. That'll be hitting the right. Nigel, sorry. Yep. Okay. Well, that's moving. It doesn't really make any things easier from Te Horo Beach perspective, Mike. But we're keeping battling on. And and look, also that safety meeting that we were at up at Otaki earlier this week, it looks a huge issue up that way as well, and the linkage between Otaki and Levin, and the fact that Levin doesn't have any public transport. So the people that again we talked that line that we have that really breaks our community and pushes people north, when in actual fact there's no connection north. Which makes that very, very difficult. So I'm hopeful that we can address that in days to come. That would be much appreciated. I might ask for a report back at a future meeting, if that's all right. Fabulous. Okay, Jackie.
Thank you, Mr. Chair. I'm just wondering, since we have just had the safety symposium in Otaki, whether or not this would be an appropriate forum to just speak for 3 minutes on it to give a slightly broad outline of what went on and what it was like as a place for meeting minds and how it might help with social sustainability.
Sure. I
Would
might
this
ask
be an
Chris.
appropriate part of your agenda?
Sorry?
Would this be an appropriate part of your agenda?
Yes, no, look, this is members' business. What I might just do first there, Jackie. Mike, did you have anything that you wanted to add from that transport perspective? If that's all right, Jackie?
Thank you. Yeah, just a final summary. I mean, we just had a forum here about health services that are lacking on the coast, and it's not doesn't bypass me that having a lack of a public transport for older folks who can't drive or need to get to essential services, an entire community just can't access it. So that's, I think, why it's relevant for me to carry on banging the drum and others that we get a bus that goes 16 times a day up and down past that neighbourhood and fails to knock on their door, allowing them to get onto it. That's all I'm saying. And it's a fixable, easy project without any money involved. And Janet's just mentioned to me that the Regional Transport Committee meets next week, and I may well go along and help to raise this again with Janet.
Yeah, do right. That sounds great. Okay, finish that one off. Jackie. Chris. Jackie was just asking really with regards to a bit of a summary on our thoughts around the safety meeting in Otaki on Monday. And a little bit of a report back on that. You touched on it before with regards to the quality of the people that were there, but perhaps just an underline of why it was held and where to from here with regards to that. Oh, hang on. Jackie, were you looking to do the report back yourself? My apologies. Love to hear from you, Jackie, about that and your thoughts around that.
Great, thanks. Look, we had a meeting with the community board and our senior sergeant police officer, and our group manager, GM Chris, was there, and she said, hey, what if we could get every government department in one room? And we were all talking about Otaki. And Chris being Chris, she made that happen a few weeks later, so that was on Monday. We were in the supper room and in Otaki that you know well, and imagine 30 people are in there. So I'm just going to give you a rundown of who was in there, because this is important. We had 4 iwi participants. We had 3 police, including the regional senior sergeant, Chris, and 4 other KCDC support staff, our ward councillor. Councillor Halliday, thank you very much. Simon, Cam and I from the community board. We had three representatives from Kāinga Ora. We had iwi liaison from Kāinga Ora. We had the manager of Otaki Medical Centre. We had the GM of Te Oranga o Otaki, deputy principal of Otaki School and another school principal, Jackie Thompson from MSD. We had a manager of work and income. We had the regional manager for corrections service there, the manager of social services for Ngāti Rākawa, lead advisor for the Commissioner of Kāinga Ora, and probation services there. Now, the really cool thing is, and this is how brief my report's going to be, is that if every one of those people wanted to have a conversation with another one of those people, or all of them, to try and solve issues, Simon Black estimated 2 years worth of meetings. Instead, we jammed and crammed our heads and laid out problems, and then laid out whose problems they were and how they could be sorted, and how some government departments' best practice is not best practice for the community at all. So we talked about how we want it to happen. Everyone went away realising what part they're playing and things going terribly wrong in our community, and we're meeting again soon. So thank you, Chris, for your wonderful idea and your very forward thinking, and we're hoping that this will be a model that other parts of the district might like to take on board and do.
Thank you for that update, Jackie. Much appreciated. Janet.
Yeah, so it's not the same thing, but a similar thing did happen in another part of the district on the 21st of August, where we were discussing, in particular, the local, what had been happening at the railway station, but also youth issues in general. And we had the area commander from down here, so that's good. We've done the same thing with police, or a similar thing with police down here as well as up there. The area commander for youth, the community constable, so good police presence there. Also MSD, KYS, ZL, Community Patrol, Metlink, the people who do security for the stations, representatives of all the colleges. We had some iwi representatives.
It was a substantial
And
list.
some other, just the minutes don't have the organisations that were in the room. But that same comment was made that there's, over the recent past, there hasn't been a lot of communication between all those different organisations and groups, and just getting together in a room, you could feel a sense of relief. Finally, we're all in the same room talking about this. And also just creating that database so that a lot of them didn't even have each other's contact details. They were, you know, handing out cards. So you're really fantastic. Congratulations, Chris. And we're sharing ideas about how we might get some ideas from what happened in Otaki for our second youth hui, which is happening in a couple of weeks.
I might just add, we assumed we were going in there to talk about youth, but it wasn't the problem, was it? The big problem for our police in Otaki is the 501s and those people who Kāinga Ora are bringing in to Otaki who have no connections in Otaki, and they're going into not so hot emergency housing with no connections. That is the single biggest problem for our police that is perhaps responsible for up to 70-80% of call-outs in any weekend.
Yes, and look at another aspect that, of course, was we're talking
Significant.
about the connection to live in. No public transport to live in. So people are supposed to meet their probation and go and see people up in live in. Problematic. Look, I just want to commend council officers and Chris for that mahi as well. I've talked about overarching umbrellas, and I see our role as being the organisation that can bring these groups together and facilitate this. But you were tenacious up there, Chris, with regards to putting on the organisations to be talking to each other and to be thinking about how they can work together with regards to what I would call common sense approaches in a combined way. But really putting it on an outcome focus with regards to things. And I've got a feeling this is the beginning of these processes, and long may they continue, because we start bringing those groups together, get them working together, and we can only benefit from that. So that's fantastic. Thank you for bringing that up, Jackie. Yeah, boom. Right. Does any other? We are okay on time. Is there anyone else that's got any thing that they'd like to bring up from a member's perspective? As such, discussed in this format. I have one small thing around housing. Actually, we had a hui Monday, I think it was, and that was in response to Councillor Kirby, actually, with regards to when we talked about the Community Land Trust. One of the pushbacks on that was, hang on, if we talk to our local providers, do we take advice from them? One, if it's needed, or two, is there a gap there, or what? So we had a very good turnout on Monday. It was facilitated. The facilitator came in. Some very good, and it was treated as a workshop. So I don't know really what information went down there too much that's been correlated and is going to be brought back to us as such. But again, some people in that, a lot of people in that room that can make a big difference in our community. And I think they appreciated being brought together for just for general conversation. Likewise, in those sorts of situations, what you find is people sitting next door to each other all of a sudden have a common interest and look at ways of moving or progressing things in our district, which I think is fantastic. As such, that was a good outcome there, and I'll be looking forward to see what comes back to the table in that space. I do know that the Community Land Trust, as a decision point, I think it's looking around November sometime, and there'll be some reporting coming back. Not too sure if it's going to come through here, whether it's going to go straight to Soft or Council, simply because this is already a piece of work that's quite substantially in train as such. Yep, and I'm happy to answer any questions about, or anyone else at the table, any questions that community board members might want clarified in any sort of areas at all? Nope. Okay. That being said, I think we're just about done. Anyone got a closing karakia? I'm going to look at you, Janet. Yep, I would appreciate that, Sophie. Thank you. I'm going to have to get myself up to speed in that space.
Unuhia, kia uru tapanui, kia wātia, kia mama, te ngākau, te tinana, te wairua, i te ara takata, koia rā i rongo, whakairia, Ake ki runga kia tīna, tīna, haumie, huie, tā kie.
Well, that will close the meeting. Thank you all very much for your attendance. Much appreciated having a full table. And I'm looking forward to this committee expanding, or not so much expanding, but being